Hey everyone, welcome to our presentation on prescription for chronic pain, physical therapy as an alternative to opioids. I'm Jason Chandler.
And I'm Ellie Shear, and we're both student physical therapists. This is going to be the first in a three-part lecture series of our prescriptions for chronic pain, and the first is going to be on what chronic pain is.
Cool, so let's get started. Alrighty, so let's start off with asking what is chronic pain? The International Association for the Study of Pain defines pain as an unpleasant sensory and emotional experience associated with or resembling that associated with actual or potential tissue damage. What this does is it implies the influence of biopsychosocial factors into our perception of pain and negative affective states alongside pain. There's three ways to break down pain: nociceptive pain, inflammatory pain, and neuropathic pain. Nociceptive pain is the response of sensory systems to actual or potentially harmful stimuli detected by nociceptors. Inflammatory pain is associated with tissue damage and the resulting inflammatory process, which may also lead to hyperalgesia or allodynia. And neuropathic pain, which is a localized sensation of unpleasant discomfort caused by damage or disease in the peripheral or central nervous system. So in the transition of acute to chronic pain, the physical and psychological side effects are widespread. These effects include alterations in the dopaminergic pathways from the frontal brain to the nucleus accumbens, which itself has a significant role in the cognitive processing of motivation, aversion, and reward. In acute pain, the level of dopamine transmission is increased, similar to the way addictive substances work. However, in contrast, chronic pain increases endogenous opioid transmission, lowers brain opioid binding potential, and eventually puts the nucleus accumbens and the frontal brain in a hypodopaminergic state, meaning that the levels of dopamine are lowered over time. This is the opposite of what's seen in acute pain. What this does is it reduces the motivation towards normally pleasurable stimuli, also known as reward deficiency. We'll get into more of this later when talking about the mechanisms of addiction, but for now, just keep in mind that this neurological state of chronic pain primes these patients for addiction to exogenous substances in order to not only reduce their pain, but experience normal feelings of reward and pleasure through no fault of their own. Pain is a multidimensional framework. When considering a person's individual pain experience, it goes far beyond the physical sensation of pain experienced through nociception. A person's sensory experience of pain is altered through psychological, behavioral, and social components, resulting in different chronic presentations of different individuals' pain experiences. The eventual dysregulation of reward processes as a result of chronic pain states leads to impairments beyond the scope of pain sensation alone and impacts a person's sensory, psychological, behavioral, and social functions in a bidirectional relationship that may also increase their pain processing in the chronic state. You can kind of see what I'm talking about in this diagram up here. It has the altered pain processing in terms of chronic pain and all of the other factors that we just talked about, kind of going around in a circle, demonstrating that they're all one another linked.
So now to talk a little bit on the prevalence of chronic pain. We have seen just how prevalent chronic pain has become, especially in the last few decades. It's estimated that over 116 million Americans suffer from chronic pain. These numbers have been seen not just in the US, but around the world. As you can see by this infographic, the CDC reports that more people are living with chronic pain than cancer, heart disease, and diabetes combined. Clearly, this is a public health crisis. So getting into some of the risk factors of developing chronic pain. One factor is our aging US population. A study done in the British Medical Journal estimates that 33% of people over 65 have chronic pain. And another 2017 study from the Journal of Manual and Manipulative Therapy shows that up to 62% of people aged over 75 suffer from chronic pain. It is thought that the psychosocial aspects of aging, as well as an increase in inactivity, may also play a role. Mental health has also been a well-researched risk factor in chronic pain. Co-occurrence of chronic pain and depression has been reported up to 80%. A 2016 systematic review in Mayo Clinic proceedings states that an estimated 50% prevalence of depressive symptoms in patients with fibromyalgia, TMJ, chronic spinal pain, and chronic abdominal pain. Another study within this review states that people with neck or low back pain were 2 times more likely to experience an episode of depression. Conversely, this article shows that pain-free individuals with elevated levels of depression were 4 times more likely to develop neck or low back pain at 6 and 12-month follow-up. Lastly, many social factors are thought to play a role as well. And these factors include things such as tenuous housing or employment, below average family income, divorce or separation from a spouse, and lower levels of education. And now for the burden of care. With an increase in chronic pain prevalence comes an increased cost for care for chronic pain. An estimated healthcare cost associated with chronic pain is over $600 billion yearly. A 2019 article in the Journal of the American Medical Association reports that this $600 billion comes from direct healthcare costs, days and hours of work missed, lower wages, and the cost of pain is more than the cost of heart disease and cancer treatment. A 2013 systematic review in Pain Practice Journal shows that an average of 10 extra visits to the physician for episodes of care driven by severity of pain. They also found that people with chronic pain get prescribed 3 times more medication on average and have more days spent in the hospital than patients without chronic pain. This all leads to increased healthcare costs, with patients suffering from chronic pain paying at least 2.5 times more money for healthcare. The same systematic review mentions negative effects of chronic pain on activities of daily living, including tasks such as walking and getting dressed, but also more psychosocial impacts on things such as maintaining relationships, sexual function, and an increase in depression. Lastly, patients with chronic pain also experience unemployment or loss of employment, miss more days of work, and have increased disability. So what is being utilized to treat chronic pain? While many options have been proposed and studied to combat this chronic pain public health crisis, the largest intervention by and large has been the prescription of opioids.